It's live in seconds. Yeah. Good morning, ladies and gentlemen. Delighted to echo a warm welcome to Inconversation under the aegis of Baroda book. And the topic that we have selected is coping with coronavirus or COVID-19 and the future of healthcare. Since the beginning of this year, 2020, the world at large has been hit by a health crisis, the kind of which we haven't seen in time, and the swiftness with which in last 4 or 5 months it has engulfed all the countries. Hemant, unmute. The swiftness with which it engulfed the whole, in fact, is unprecedented. Accompanied with this unexpected, out of the blue, Romain, you will have to unmute, and Hemant, you also please.
Yeah, we are in.
Accompanied with this onset of pandemic is fear and anxiety which has gripped our minds and engaging our all the thoughts, and maybe we are passing sleepless nights, and there is a reason for that. What is that? Within a span of less than 4 months, as of yesterday, people with this coronavirus, the deadly lethal infection, has already touched the number worldwide of 12 million, a death of close to 560,000 people, and closer home in India. Yesterday, the All India figure of 850,000 infected cases has been reached. Unfortunately, 24,000 people have already died. And the curve of infection is still rising. This is really very, very worrisome. But let me tell you, the existence of endemics and pandemics is there since inception of the humanity, in as much as the first evidence of viral or bacterial infection to hit the community 3000 BC, Sirsa, Neolithic times. According to preserved site at a place called currently the part of Mongolia, the civilization that was existing in that local area, entire population was extinct because of some endemic or some bacteria which infected the people. Talking about recent centuries, we have seen such pandemic and major infections in the 15th century called the Black Deaths, which lasted for several decades. Then again, the bubonic plague of 18th century, and in last century, in which some 55 died, with some million people died. And in this century, while swine flu and Ebola and the likes, even Zika. And, we are all struggling, and this is all because of the climate endanger that has happened. So, it is very important for us to understand, as we chartering and uncharted waters, uncertainty is still surrounding us. We are groping in the dark with respect to ramification, the full blown effect of this endemic. In the midst of all, we need to know virulence is virus, and how we have got today very eminent faculty.
I think is I think it seems Sunil has lost the connection. Rumin, please unmute yourself. Yeah. Well, friends, I'm sorry. I think Sunil has some connectivity issue and he should be with us. I am Dr. Hemant Antani, and many of you know me very well. So by the time he connects, I think it would be, worthwhile to actually start, whatever we are here for. So I must thank the Baroda Book Browsers Club and Sunil in particular for making me participant of this lovely In Conversation. Well, friends, we are all distraught right now, dismayed, distraught, distressed, fearful, anxious, and apprehensive, and for the right reason, because we are in the turbulent times that we never had experienced so far in the entire of our life. Because this is a similar thing happened about 100 years back. And so this is the time where the medical health care is perhaps the focus of attention, and for the right reasons. So it would be apt to really discuss about what exactly the COVID has done to us and what is in store for all of us as far as the medical health care is concerned in future. So let me tell you that, the COVID has really opened up many things for everybody, including the doctors, including the health fraternity, including the people. And you would see that the importance and fragility of human life was never understood better. And I'm sure that you would all agree. The healthcare professional role is, I think, more well perceived and appreciated much more than it was, all these years. Because many people, many doctors have, almost 110 doctors have died so far while treating the COVID patients. The shortcomings of healthcare is totally highlighted. It is really come in open, whether it's not just India, it's the entire world. And having seen the corona epidemic, which has really spread into the entire world, you can easily see that the global healthcare policy is totally wanting. And this is the time that we really have to do something, because I can tell you as a doctor that this COVID or corona is not the only one, not the last one. Get ready for many more such viruses which will come from nowhere and hit you again and again. So we have to be ready. So, as people say that this would be normal, new normal, but I would say it's a new, better normal, because I think our, perception about health and the hygienic care would definitely be much more than what it was before. Now, let's see whether we are ready for this kind of healthcare problems which we are already facing. There are no beds, not enough equipments. If you look at India, there are only 0.5 beds per thousand of population, which is, isn't it alarming? So we are actually 145th out of 155 countries. Dismal, isn't it? And as far as our, the expenditure on healthcare is concerned, we are actually spending only 1.6% of GDP. So that also we are actually 184th. I have to give a simile, actually the US entire healthcare expenditure is much more than our entire GDP. So that is something, be very careful about. Sunil, I started with your permission. Sunil? Okay. So, now let me tell you that what exactly is the health system that we have today. It is more of a sick care system. Like you get sick and you go to the doctor, you get the treatment. I am also equally part of the entire system for the last 35, 40 years. And I am also equally responsible when I say this, that the prevention is not something which we are really given a lot of importance to. That has never been given a priority by patient and a doctor as well. So this is something which is extremely lacking. And I think if you look at the entire scenario, very few percentage, most of the time the patients are not involved. They just do what the doctors say. So they are not basically involved in managing. For example, a diabetes patient, doctors would say do this, but they are not involved themselves in doing the sugar themselves. That percentage is very less, I can tell you. And the best of the best treatment, if you want, not that everybody can afford. The another part which is very important is when we are discussing about the future of healthcare is the errors in medicine. Now, there are several errors. The time doesn't permit, whether it's a medication error or it's a diagnostic error or there's a negligence or anesthesia, so on and so forth. There are several 15 types of errors that we have actually found out. And if you look at the statistics in the United States, almost 3 lakh people die because of the medical errors every year. So almost 1% of the hospital admissions are because of that. And it is the third leading cause of death. So you would ask this question that are these medical errors inevitable or they are avoidable? Well, the friend's answer is very simple. They are not bad people in the medical healthcare. They are good doctors. But the problem is the system is not as robust as it should be. The system is not as precise as it should be. So then my question is that why should you expect that the healthcare would change, for better, and lots of advances will happen? If you look at the 7-year cycle rule, I mean, some of you might be aware about it. It's that every 7 years, the innovation happens, and that innovation keeps on mounting. There are several examples, that, for example, genomics and robot surgery, it started in 1998, and now it has become, very much in many, many surgeries. Smartphones, it just came in 2007, and billions and billions of phones are there. So this is very important. So friends, the future of healthcare, there are certain things which are going to happen is a telemedicine, wearable sensors, biosensors, artificial intelligence, big data, nanotechnology, pharmacogenomics, 3D printing, robots, virtual and augmented reality, and biomedical engineering. So what I'm going to do is I'll give you a very short brief of two things, and then rest of the very exciting part will be taken care of by my very dear friend Rumin. The telemedicine, all of you know that it's already come here to stay. Some of you might be using, where the doctor and patients, they don't have to see each other in person, but all the data from the patient is transferred to the doctor via several platforms. And I think it is more accessible. The time is, saved, and it is cost effective. There are several doc-on and helplinks, etc., available. So I call it as a healing from distance. And then most important advances which are coming, in fact, already are happening, are biosensors. Biosensors are the devices which would sense, several things. They're not technical things, but what important for you to remember is there are at least 11, 12 types of sensors which are created by the, scientists for us, whether it's enzymes or microbes or immunosuppressors and so on and so forth. They're simple. Actually, they're very highly sensitive, so they give you a very good idea. And the challenges will be the accuracy and affordability. If in diabetes already, the Guardian Connect, and some people are given those, stickers here, and your blood sugars are monitored. So sensors are already here as far as diabetes care is concerned. And there are certain sensors, there are certain apps which actually monitor your heart rate and blood pressure. So it's already coming. It's already in. And in fact, you will find that a lot of things are going to come. So consumers are tracking their health much more than they were tracking before. Now, what might happen in future is something which is, mind-boggling. There will be toothbrushes which will have a breath sensor, and from that they will tell you whether you are suffering from any disease or not. There would be biostickers, the palm-sized gadget, which would, it can measure your ECG, heart rate, and everything actually given to the physician. The most important thing which might happen is there will be low-cost bioelectronic devices that will be implanted in your body, and it will develop and program wirelessly in such a way that the right dose at the right place for the right disease for the right patient, it is given, so that the right dose goes, no complication, actually affects the target only. And so the future is you will have a digital stethoscope and digital portable ECGs and digital otoscopes. You will have the Bluetooth enable implant, the tattoos. You will have smart mirrors in your bathroom, which will decide whether your genetic structure is fine. You will have a smart toilet. Sitting on that will decide whether you are going to suffer from something or not. And then there will be personalized therapies, depending upon what you should get on a pharmacogenomics. And you will not have to go to the store, but the drone will come to your place and will drop the medicine. So I know there are certain eyebrows raised, and it looks like a Harry Potter movie. But friends, let me tell you that innovations are exponential, but the perception is linear. So I'm telling you that the innovations are going to be much faster than what you realize. And my last take is, the question is that within all these, future healthcare, where machines are going to decide what is the role of a doctor. I tell you, friends, doctor will have to be in the center. Computers can't think. Computer does what doctors tells, but doctors' hands have become very strong with very precise medicine, precise data, precise information, and a very specified, focused information which doctor wants. And that's why some people call it as a deep medicine, which is coming. And I'm sure that with this future healthcare, the humanity in general would definitely be at advantage, and maybe the coronas in future will be taken care of in much better way. Thank you very much, and it's now Rumi's turn.
Yeah. Morning. It's a pleasure to be part of such a great forum discussing the present COVID scenario and the future of healthcare. Well, we are amidst a times in which there is enormously disruptive and massively devastating COVID pandemic has affected virtually all lives to a very significant extent. Healthcare industry in general and medical profession in particular, they have been subjected to intense scrutiny and immense stress due to this pandemic. Well, to be very precise, the practice of medicine is an inexact science. No wonder there are people who are sarcastic and say that doctor has always been practicing. He's never a doctor who gives you treatment. A doctor uses patient symptoms and clinical examination to decide relevant tests, to gather more data, and then diagnose the disease and go for further line of treatment. The complex human physiology, complicating myriads of pathologies, multiple differential diagnoses, and plenty of treatment options have made medical decision making a little maddeningly complex. This thing, there is an inherent guesswork which reduces the efficacy of intervention that we offer to the patient. Now, medicine is broadly divided into diagnostic medicine, therapeutic medicine, the treatment part of it, and preventive medicine. Each of them has a domain of specialists and subspecialists offering treatment options and looking at public health policy. Now, the slow phase of progress in medicine, if you see, why is there a slow phase of that? Is entirely because we have, as I'll show you, this dictum that we follow of our father of modern medicine. He is Hippocrates, the father of modern medicine, said the physician must be able to tell the antecedents, know the present, and foretell the future. He must mediate these things and have two special objects in view with regard to disease, namely to do good, but very important, to do no harm. So the basic tenet of medicine that we practice is primum non nocere. First, do no harm. And that is the reason whenever a new diagnostic test, a new therapy comes in action, it has to undergo a lots and lots of trials, and we have to be very sure that it is not only effective, but it is safe also. And therefore, the complexity of medicine now exceeds the capacity of human mind, and therefore, the complexity of medicine then are so much, they are so wide, and they exceed the capacity of human mind. And therefore, medical knowledge is now expanding so rapidly at an exponential speed. You know, innovations in every field of medicine. It is difficult for an individual or a group to keep pace with that. And that is why there is an advancement in immunology, genetics, molecular biology, biotechnology. And fortunately for us, we have computers. Computers now have enormously helped us in finding out how to manage the patient. For example, EMR, electronic medical records, which is a norm in USA, gives a huge database to patient, to insurance company and to healthcare sector, and that in turn will decide the data, will decide the statistics and the information that is necessary. And therefore, now we have big data, deep learning, machine learning, and natural language processing, which in turn helps us in deciding the further line of action, the best possible treatment that we can have. This field of artificial intelligence, IBM's, for example, Watson for oncology, it's a program, accesses more than 300 medical journals and textbooks, and reads everything available on cancer, and that in turn decides the line of action for a patient of a cancer individually. So which patient, for example, of breast cancer should undergo X number of tests and Y number of therapy will be decided now by this computer generated program, which has been hallmark of IBM. Now, there are advances in genetics, and this has made it very possible to predict the likely disease that a patient is going to have, the profile of investigations that we should be doing, and the prognosis, and a tailored medicine, which is known as precision medicine or pharmacogenomics health medicine. And therefore, these are the things which will help us in achieving our goals of making human being free of disease. Now, there is a problem, and it was previously believed that sooner or later we are going to have so that you can see that there were issues, and there is a belief that sooner or later we'll have no doctors. We'll just have machines. Machines will look at us, machines will decide our diagnosis, and machines will treat us. But believe me, without doctor, it is impossible to be all right, at least in present scenario. Now, coming to the flip side of these innovations in medicine, the healthcare cost is escalating, and we see a huge number of patients defaulting, mainly because of cost of healthcare, unavailability, and social disparity, which makes it very difficult for an individual to afford the cost of a medical intervention. I'm sure the deliberations that we do today will help us in making things clear for all of us. Sunil bhai.
I think so. What we can do is, Rumin, I think we'll have to handle, because there is some. You can just keep your audio on, Rumin. Please keep. I think you know. Sunil is lost. So if you allow me, Rumin, can I little bit add to what you have done?
Absolutely.
Already said, because that could have been a part of the question. So if you, some of the things, friends, Rumin has already said, but you know, some of the things which I just, let me give you, you know, what's going on and what will happen. He has already very nicely said about the flip side and the good side. The most important thing which will happen in artificial intelligence is what we call as a neural network. I mean, neural network, you know what will happen? That it will be able to determine whether this person is going to get one disease or not. Mind-boggling, isn't it? Now you would have heard that the things are all omics, you know, it's OMICS. It's a redomics or genomics or pharmacogenomics or nutrigenomics, so on and so forth. So the redomics is so important, because, you know, whatever the human eye cannot perceive, you will be able to get the diagnosis of, you know, something beyond PET scan in fractions of seconds for thousands and then thousands of patients. So that will help a doctor in a big way. There's something called as a pill cams. Some of you might be knowing that at least very, you know, very small version of this is available. For example, some people must have heard about the endoscopy, which is done through the pill, you know, where you're made to swallow the pill, it goes inside, takes the pictures, and then you can you know, kind of see what exactly is problem inside, which is happening right now. But friends, you should be ready for the future, when what will happen is that this pill, you know, cam is going to be a reality. It will find out the growth. And don't be surprised, we may or may not see that, but the nanosurgeons would come into the play. So through pill cams, you will be able to do a microsurgery only where it is required. So that is also something which is going to happen. Another thing which is going to happen, and in fact it will happen perhaps during our lifetime, is some of you must have heard the name of Illumino. This Illumino is a, you know, which is a DNA sequencing giants in California, US. They are already doing genome, but then, you know, it's very expensive, as Rumin rightly said, that it's not easily available. So I see a time not very far from now, maybe 5-10 years at the most, is that, you know, like you get your blood tested for vitamin D's and sugars and cholesterol, in just $100 US, that's what Illumino has promised. You go and get your entire genome done, genetic sequencing, so that you know that whether you are vulnerable to these or vulnerable to that. And this is going to be very useful for the very young people. Clinical trials, Rumin talked about. Our problem is that, you know, we can take only few patients at a time, like few thousand people, and you know, there are lots of time which is gone. There's something called as the in silico trials which are going to happen, which are a simulation trial. So imagine that millions and millions of the virtual patients are simulated for the drug therapy effect, and that you can have result in no time. Well, the time perhaps we may not see, but this you might find it a little bit, you know, or something like, as I said, it's a fictional movie. As well, you have a problem, you go to a clinic, with a biomedical engineering clinic is next door, you go there, oh, my arm is not working well, so just, you know, replace it. So it's a clonable organ, which is going to happen very soon. Robots, you know, it's already happened that, you know, as I said, that it was, I think 1985, when Puma started, you know, robotic cover. So that has also come into picture. Virtual and augmented reality has helped the surgeons to get trained. In fact, the Harvard came up with one data that virtual surgeons, you know, when they were actually kind of trained by virtual, they were actually almost 125% better. 3D printing is something, friends, which is going to be a reality. For example, the prosthesis in your valves, on your skin grafting, the 3D printing is going to help and make the doctors much more powerful. So these are the things, and I said already about the you know, smart toilets and smart you know, toothbrushes and smart mirrors and implanted. So, well, exciting time are there, but then the flip side, as Rumin very rightly said, that perhaps the divide between haves and have-nots would be even more, as Harari rightly said in 21 Lessons for the 21st Century. So, Rumin, you want to add something on this?
I think we go ahead with the second part of the COVID scenario right now.
Okay. But I think
Hello?
if
Hello?
Sunil is not there, okay, Sunil is back now. Yeah, okay, fine. Please go
Hello?
ahead. Yeah,
Hello?
Sunil, yeah, please go ahead.
Hello?
Yeah, we can hear.
Yeah.
Yeah, very well. Please
Can you
go
hear
ahead.
me? Hello?
Yes,
Yeah.
yes. Yes, Sunil, we can hear you.
Shall we start with the first question or the first discussion
Yeah,
point
please
that
go
we
ahead.
had decided?
Because let it be on. Yeah.
Yeah.
Please go ahead, Rumin.
Yeah. Yeah, now, Hemant, tell me, what is this novel coronavirus and why is it more lethal than SARS and Ebola virus that have also happened in recent years? How is it similar to or different from Spanish flu of 1918? And why is it more feared one?
Yeah, we are
Your
all
take on
scared,
that.
actually. Two things I would say that, it's not lethal. I mean, you will be amazed when I say these words. But if you compare with Ebola had almost 34% mortality, although the number were less. If you compare with SARS, which happened in 2003, which happened in Middle East through camels, that also had a mortality of 10%. Spanish flu was by influenza, altogether different virus. At that time, it was the Second World War, and that's why a number of patients were more, and they did not have as much, passive. But having said that, this coronavirus is new for us, but at the same time, it is proven that it is extremely contagious. It goes from person to person so fast, especially because through fomites, and that makes it, very, very difficult virus to handle. So it's not lethal, but at the same time, it is extremely contagious, and that's why you never know that when you are part of it, whether you are part of that mortality time or mortality rate, or you'll be. So this is a very different virus from that angle.
Shall I go ahead with the second question, or because that's I'm supposed to answer there? The second question that was lined up was, what are the broad stages of this infection spread, and what stage would intervention be more effective, and how is it going to be effective? So let's, I'll just show a small slide which will tell us where we are right now and what should be our strategy. Now, any disease, any pandemic, or any epidemic or pandemic passes through 4 phases. The first one is imported cases or sporadic cases where there are only very few people are involved, or the infection comes from a foreign country. This is followed by a second stage of local transmission, in which the disease is transmitted from one person to another person in close contact. A third phase of the disease is community transmission, which is what we are going through. And we are almost actually into stage 4, which is known as epidemic phase or a pandemic phase. And that's where we are. And that is where we are seeing such a huge surge of cases of COVID. Now, it is in the stage 1 and stage 2 that some steps, preventive steps, would be effective and would be very, very helpful in preventing the worsening or the spread of the disease and spread of the virus. For an individual patient, if you see, the patient could be having a COVID, would pass through 2 or 3 stages. The one is incubation period, in which the patient would have absolutely no symptoms. He has just been infected with the virus, and this in COVID is supposed to be maximum 14 days. And this is then followed by symptomatic infection, which is mild to moderate. The viral load is going to be high in these cases, but these patients are usually having very mild problem like fever or throat pain or mild cough. There are 2 stages which are very crucial stages, and one of them is severe stage, in which there is hyperinflammation. The host immune response is very high, leading to something known as cytokine storm, leading to acute lung injury. And then there is a phase which is very critical, and a patient, if he makes or comes out through it, is a recovery stage. It is the severe phase, it is in the mild and moderate phase that we could be of immense help to the patient by giving supportive treatment, by giving definite treatment. Even in severe cases, we have now established drugs which are available and are helpful in such patients And in treating the disease, treating the complications like acute lung injury, treating the complications like clotting of blood, treating the complications like bleeding, and treating the complications like heart or liver involvement. So this is where we are. And if we are good enough or aggressive enough to detect the patients in the early phase, and at community level, if we are at, I'm sorry for that. So it is when in the initial stage, when the viral response is, viral load is very high, when the patient has mild constitutional symptoms and fever and some of the blood parameters, it is extremely easy to treat the patient. Quite a number of patients can be treated at home. This is the second stage or pulmonary phase in which there is shortness of breath. We all have pulse oxy at home now, and we have been, I'm sorry for that. We have been using pulse oxy to detect a low level of oxygen. It is here that intervention is going to help. It is here that patients should be hospitalized. It is here that patients should be aggressively treated. Of course, the third stage is a stage which is a domain of an intensivist, domain of a tertiary care, and that's what we will not discuss. So basically, lots of drugs are available to treat a patient for suppressing the immunity, for taking care of the cytokine storm, and for taking care of the complications. So basically, it is in these phases that we can help, initial phases. And as far as patient care is concerned, we will be able to stop them at the early phase. So over to you, Hemant.
I think Sunil is there. Sunil is, I think, yeah, please go ahead with the question.
The question is for you, Hemant. What is herd immunity? How does it help? And how does any individual's immunity level, immunity is a now buzzword, does help in mitigating the infection?
It's a, herd immunity is something which everybody wants to know about. Now, let me just explain what happens that herd immunity is, one where the majority of the people in the community, they get infected so that they develop antibodies. And that's why what will happen is that the transmission will actually stop, because there are lots of people who are immune. That is called as a herd immunity. And how it helps, because it will help to mitigate the spread of the disease, and that is what everybody is waiting for. But at the same time, the problem with the herd immunity development in a natural way is that, for example, for every virus there are certain percentage which are predicted. So many people, most of the people, those who are experts, they feel that it is about 50 to 60% of the people who should get affected to develop the herd immunity, so that the mitigation of the virus spread happens. But then if you remember, you just try to understand, in a 1.2 billion population, if 50% people become sick, then what will happen to our healthcare? So that's the biggest danger. But then second way, and that is what everybody is waiting with, bated breath, is a vaccine. Vaccine will give you the herd immunity and will definitely stop the propagation of virus. Now, your second question was your personal immunity. I think it's always going to help, whether it is corona or any other disease. You have to make sure that you take care of yourself, because it is something which you have to do. Right kind of food, right kind of vitamins, D, C, zinc. When everything is known to you, so you have to make sure that you eat healthy, live a very healthy lifestyle. And if your innate immunity, that's a basic immunity, is good, it's not just corona, it's going to help you for all the diseases.
Oh. Shall we go ahead with the next question?
Sunil is not there. I think you just continue, Rumin.
Okay. So the question that is supposed to be answered by me is, while cluster living impedes social distancing, a recommend.
Unmute yourself. Rumin, you have muted yourself.
So while the question is, cluster living impedes social distancing, because there is no social living distance when you are in a cluster. Now, social distancing is a norm which is recommended for preventing spread of the disease through respiratory secretion. So is it not an enigma that same cluster living helps fight virus more effectively and get more antibodies? So that is a question that I am supposed to answer. Well, I completely agree, and I'll show one slide which shows what is importance of clusters and what is the importance of social distancing. Now, the standard recommendation is the buzzword. The social distancing is extremely important, is an absolute norm, absolutely essential for control of droplet infection spread. So a 2 meters or 6 feet distance is completely necessary for preventing further spread of COVID in a community. However, in certain places in India and abroad, it has been found out that cluster living has helped patients in getting more immunity and delaying the onset of infection, or if the infection occurs, the severity of the infection is low. For example, this is a very interesting take given by, this was an editorial in Lancet in which the immunologist calls that the government should encourage everyone under 40 years to go out, get back to work, and if at all possible, do all they could to become infected. This infection would bring with it immunity, and this immunity will be helpful and much better than the immunity that you would get through a vaccine. In fact, if you look at Dharavi slum, believe me, it is not just the cluster living that was important. There are a lot of other things why Dharavi has become a success phenomenon in COVID control. But Dharavi has been a major example of how a cluster living, despite a cluster living, the infection has not spread so widely. The infection has been contained and the infection is less. In fact, if you look at Baroda itself, the initial phase, there was a huge spread of COVID in area like Nagarwada and in Machipit area. Of late, you don't see many patients from that area. You see patients from all over Vadodara, periphery of Vadodara, some elite area of Vadodara, but the patients are not seen from places like Machipit. So this is very clear that in case if you are if you have a cluster living, it certainly is going to help in building up low immunity by getting a low grade infection, getting more immunity, and therefore getting less chances of getting a severe infection. The next question is for Hemant. You, social media is rampant with well-intended but often unverified aggressive home remedial measures for boosting immunity. For example, you only told Haldar, for example, turmeric, or for example, saline gargles, or and so on. What safeguards would you suggest, including so-called alternative medicines that are recommended for preventing or managing COVID? For you, Hemant, to answer.
Yeah. Well, I know the WhatsApp is flooded with all these messages, educating everybody in a right or wrong way. Well, I'm not against any alternative medicine. My only take is that you have to have evidence to show that this is definitely going to be effective. Because unless you show the evidence, how can you really take that for you? I mean, as far as the health remedy is concerned, which anyway is a very serious matter. So this is something which you should always keep it in mind, that anecdotal things, for example, I believe that this happens this way, has no place in a definitive management of any disease as far as the medicine is concerned. Well, small things, if you do, it's fine, but I tell you at the same time, that should not give you a false sense of security that you are not going to get anything. So my humble request to everybody who is listening, who is non-medical, is that be with the science, be with the evidence, and make sure that what you are taking is definitely going to be useful to you.
Thank you, Hemant. Now, the question that both of us are supposed to answer is, in just about six months since this COVID virus has become a worldwide pandemic, what definite trends for its combat have emerged? What is still uncertain? And how much of uncharted waters still remain to navigate before this pandemic is controlled completely? First your take, and then I will have my input.
Well, it was December Wuhan, and that was the first time the virus was seen by medical fraternity. Honestly, we are still evolving. I would say that because, and I think people might get upset that why, some people say that why you're not able to come up with a definitive therapy. Well, it's only, almost just say it started in Jan, and then we are only into June. So this virus is new for us. And one more thing is that we are also going into the genome sequencing. So we are also finding that the virus also mutates. So initially there were 2 strains which were found. One was called L and then S, and then some other people came up with 3 types of strains. So on and so forth. So the virologists also are in the process of evolving. Lots of uncharted water. I would say, in fact, right now, what we have been able to do is also something remarkable, for the simple reason that at least we have been able to find out 2 or 3 medicines which are making patients better. Now, having said that, we as a medical fraternity do not say that these are a definitive curative medicine like chloroquine for malaria or something. But many patients are being, benefited, and their lives are saved by, some of the drugs that you all know, that remdesivir and tocilizumab and Dexona and so on and so forth. But at the same time, we are also in the process of, developing ourselves, learning ourselves. Another very good thing which people have done is about vaccine development, and that is where I think this is the fastest development as far as the vaccine is concerned, never experienced in the history of medicine. Those friends who want to know, it's very interesting to know that which vaccine had the least time to be invented, and that was Ebola. And you know how much time did it take? 5 years. So even if the vaccine was taken in 5 years, found out in 5 years, it was considered to be a great achievement. So I think everybody believes that this is the RNA virus, a different way of things are happening. So it's possible that in 2021, about mid 21, we should be able to have vaccine, and then itself is a big thing to happen. So lots of uncharted waters, many lessons we have learned. We already said that about the global health policy, many things about your personal hygiene, and many things that you understood about the infectiousness of virus and your responsibility towards the community.
So thank you, Hemant. I have some inputs. If you look at the definite trends for combat of this virus, there have been certainly lockdown, a long and huge lockdown, onset and beginning of personal protection. Mask, for example, wearing mask has now become a norm. Social distancing, avoiding crowded places, a huge awareness about this. A patient comes to you even with minorest of symptoms. There is a mass detection drive going on at certain places. Then isolation and quarantine have now become buzzword in initial part of the treatment. As far as management is concerned, I'm sorry for that. Management is concerned. We have now been able to at least risk stratify patients depending on patient's profile as to whether patient is going in for hospitalization or is going to be comfortable at home, and even home treatment is going to be all right. Then management at hospital and ICU, there are now protocols all over each hospital, and each society or each body has given its protocol for management of such patients. As far as uncertainty is concerned, the first and most important uncertainty to me is a perfect diagnostics. Now you need to go for that cumbersome PCR test with a lot of caveats. So when an antibody test would come, which would be available on outdoor basis with quick result, it would be a great blessing for all of us. Then there are people who are asymptomatic and still worsen, and they are likely to have recurrence and acute lung injury. So we would like to be certain about those things. We are still not certain as to who would go home and then worsen. There are a lot of uncharted waters as far as COVID infection is concerned. We have been trying, but have completely been failure as far as flattening of the curve is concerned. In fact, the disease is worsening every day. The prevention part again has not been very successful. Vaccine, as you rightly said, is still in pipeline. Mortality prevention, I'm not too sure whether we would see death rate going down in patients of COVID infection. And I'm certainly looking for targeted drugs for COVID virus and targeted drugs for the complications that we have of COVID, for example, lung injury, or for example, other complications. So this is where we stand. That's it. I think are in for some exciting times as far as new innovations are concerned. New COVID, as all of us know, is a science in development, and that is going to take time before it unfolds itself and its mysteries to all of us. Thank you, Hemant. Now, can I start with the next question?
Please go ahead.
Yeah.
Hello.
The question is, this is the...
I think Sunil is in now. Sunil, go ahead now.
Yeah, please go ahead.
Thank you. So I was tuned out. My next question is, how effective was the lockdown which was announced in India on 24th March, suddenly, abruptly? And do you think that, it has really served the cause very well? Considering that, yes, of course, the infection rate had slowed down during that period, but now that the cases are rising and, the infection is at large, has India flattened the wrong curve instead of flattening the infection curve, which is still some time away? Is the hello?
Yeah, Sunil bhai, am I audible?
Yeah, you.
Hello.
Yeah.
If let's look very dispassionately at lockdown. The sole lockdown was announced on 23rd of March, and the sole aim of lockdown was to prevent massive spread of COVID infection, the morbidity and the mortality associated with COVID infection. This was also to cut down man-hour wastage, avoid economic burden, and looking at all the parameters, lockdown has been a colossal failure. And I am not going to discuss the delayed closure of international airports or a month which went into preparing for Trump event, the abruptness of the lockdown, the migration crisis, and unlocking wars. But if you look at this chart, on the day 1, 23rd March, we had 500 cases, and there were only 8 deaths because of corona, and there were very few scattered areas where there was corona infection. If you look at as of on 10th of July, the cases, the deaths have been very, very high. In the daily, almost 25,000 new cases are seen, and we are now number 3 as far as COVID cases are concerned and COVID deaths are concerned. So, to me, lockdown, for whatever reason, was a colossal failure. Over to you, Sunil bhai. Hello.
Sunil's internet infection is affected by corona today.
Yeah.
Corona.
So this chart tells us where we stand as far as corona is concerned. Shall we go for the next questions?
Yeah.
Shall we?
Yeah, please.
Yeah. The question is, how much is enough testing being done in India? And is there a reliable reporting of figures?
I don't know how much medical question is this and how much political question is this, but nevertheless, as a doctor, what Rumin is saying makes a lot of sense because, the testing is definitely on a much lower side. If I have to give you one simile, because as a doctor, as an epidemiologist, always the rule of thumb is you should test, then you should trace, and then you should isolate. These are the 3 things you basically do. So if you don't do testing enough, actually we were only at about 4.5 tests per 1,000 of population, but now it has gone up. So if you must have said that we have crossed 1 crore of testing, but still it is too less. Why? If you look at today's figure, we are at 7.6 tests per 1,000 of population. And if you want to compare, then you will get a very good idea. For this figure, for Russia is 130. We are at 7.6. Russia is 130, and United States of America is 92. So we have a long way to go. And because the testing are less, so the numbers that you are getting could be much less than what actually, what exactly is the scenario. In our practice also, we have seen some people suffering from typical COVID are treated, but they are not tested. So, whatever could be the reason, let's not go into those policies. But what I'm saying is that government is trying its best to, scale up the testing, but it still has a long way to go. So if we can do more testing, like what the other countries have done, what South Korea did, that's how actually they were the best people. For example, Vietnam was another country. New Zealand has been able to get out of the corona, and Australia is almost on the way. So if you do more testing, and if you follow this, test, trace, and isolate, then I think we will still be better off.
Thank you, Hemant. Now the next question is, what is comorbidity or pre-existing medical condition, and is there a gray area of attributing a death of corona positivity to this comorbidity? Is what is happening now?
Do you want me to answer that?
Yeah, I can answer that.
It's okay.
Yeah, whatever.
Go ahead.
Yeah. So a patient with existing blood pressure, diabetes, bronchitis, asthma is more likely to get COVID infection. Number one, the severity of the infection is going to be very high, and the outcome, both in terms of morbidity, that is a long hospital stay, and mortality, the death, is going to be extremely high. Two major factors are age and comorbidities. There has been a subtle pressure to show that this mortality is not because of COVID, but the patient has died of, for example, a heart attack, or for example, a respiratory infection, or for example, a cardiac arrest. Most of such patients have COVID, have been into respiratory failure phase, and they die because of COVID. But it is a subtle attempt to show that COVID mortality per se is low. It is the comorbidities which kill the patient. I presume that such patients would have been alive had they been not exposed to COVID infection. That's my take on comorbidity. Any input from you, Hemant?
Yeah, having said that, most important thing which I want all the listeners to go with one very, very clear-cut message from our side, that we have a data. The deaths which happened, they were almost 7.8% were diabetic, 12.2% had a heart problem, and the death which happened, only 0.9% of the people did not have any comorbidities. About the case fatality rate, Rumin, I personally feel that case fatality rate is much less. Why I'm telling you that? Because there is not enough reporting and enough testing is done. So, for example, you are saying about out of, let's say, 9 lakhs of patients, these many patients have died. But in fact, if you are doing the testing, more testing, then you will see that this 9 lakh could be 12 lakhs. So your case fatality rate or mortality rate is definitely on the lower side. So that is the only heartening feature. But having said that, as a doctor, it's a statistic that it's a 2% or 3%. But for the family who loses one member, it is 100% for them. So we always understand that any death is never a good thing or good feeling, especially losing young doctors. Which is, Rumin, you were talking about. The youngsters, going out, somebody said that. But I have one caution here, because India is a population of young people. And if you look at the death rates, and if you look at the age group, the youngest people have died in India as compared to the rest of the world. So you just can't be very complacent that I am very young and nothing is going to happen to me. No, friends, I think the caution is always to be there. Personal hygiene and keeping away and mask, all these things are very, very important. So if you have comorbidity, if you are above 60, please, I request you as a doctor that take utmost care for at least next 2 months. Don't even meet your friends. I have been very vocal about it. Just be inside your room and just go and meet only if it is mandatory. Then only you will be able to save yourself.
Thank you, Aman. The question is, what is flattening of a cow? A term often repeated in this pandemic. And when will we in India see this flattening of the cow? Some countries have been able to achieve that. How soon are we going to see flattening of? How soon are we going to see that corona goes?
I think, honestly speaking, only God up knows the answer because of several reasons. Those who really don't know what flattening of the curve is, let me give you one example, or let me give you one very odd simile that I've been giving in my other lectures, that there is an office which has got 50 people and there are 3 washrooms. Now all 50 people want to go to washroom at single time, what will happen? But instead, if there are 5 or 1 or 2 persons go one by one, then that would be fine. So it's almost like that many coronavirus patients suddenly come up and then they gradually go down. That's called as a very tall curve or fast curve. But if you want to flatten that curve, the same number of patients will come over a longer duration of time. So what will happen? That your healthcare will not be flooded and you'll be ready to treat them. Now, about when will this end? Honestly speaking, everything depends upon how we behave. And it is so important that we have to be very careful with what we are doing. We have to be very careful of what we are saying, and we have to be very careful of what we are behaving with. So it's something very, very important unless that comes in or not inculcated within, because so many people we see without masks, they are not unnecessary, they are just gathering and there's no social distancing. And as long as this happens, Rumin, I think as a doctor, and I'm sure you would also agree, that we still have 2-3 months of a very intense bad time. If at all 3 months, if we come out and start going down, I think it would be lucky. So it's very important that the people behave.
Completely agree. Thank you, Hemant.
Rumin bhai, this is Samir, and just to let everyone knows, because Sunil bhai requested me just to facilitate this discussion, since there is a
nice to have you.
my pleasure, and since there is a bandwidth issue at his end, so you can complete the questions which you already have. And I just want to let both of you know that there are lots of questions on the chat box, and many of them are very, very relevant, and we will have to keep some time to address them. So please complete your questions, and then we will come on the chat box.
Yeah. So the question that I'm supposed to answer, this is relevant. I agree. We'll cut down the.
I think we can go to the chat box question if it is okay.
Yeah. There is this question. New evidence is emerging that this pandemic is contagious also because beyond contamination of surfaces and respiratory secretion, aerosol or airborne transmission can carry the virus. So that is what I'm supposed to answer. Shall I answer that now?
Please go ahead.
Yeah.
Go ahead.
Yeah. So there is this clear cut. We have been hammered right, left, and center that it is droplet. It is the infection which is because of contamination, either is because of droplet or a contact transmission, which leads to corona. So if you are unfortunate to be in contact with a patient or with a droplet that has been come out from patient's any surface, you are likely to get that infection. So primary transmission is because of droplet, but there are lots and lots of papers now in huge peer-reviewed journals which say that this may not be the only way of transmission of COVID. And there are papers from all over the world that COVID may transmit through aerosol transmission for COVID and public health, and aerosol. Does COVID transmit via expiratory particles? In fact, there are now some who believe that air pollution may influence COVID-19 outbreaks, and we unfortunately have very high amount of air pollution. And therefore, this was a notice or sort of a request to anesthesiologists who come in close contact with patients that there is a short-range aerosol transmission of SARS virus is very, very likely. And therefore, universal airborne precautions are very necessary. And this is not only for anesthesiologists. This is also for ophthalmologists. This is also for dental surgeons, and also for those who come in close contact with patients or patients' relatives. In short, let us not be very sure that it is just we have avoided or we have kept ourselves clean or been very good in hygiene, we are not going to get infection. There are some other ways of transmission of the infection, and that is what we should be taking care of. So now, as you rightly say, I think we go to now I will go to, sorry for that. We'll go for one or two last question. The question that both of us are supposed to answer is whether, I mean, it's a political question, but I will still consider it before we go to the question. And how would you rate governments and its agencies' handling of this pandemic on a scale of 1 to 10? Hemant, your take, and then I
think you should answer that first. You know, you are more qualified than me in answering political questions.
Okay. So if you look at some parameters of handling a pandemic by a government or by an authority, you have to look at awareness created in people, the preemptive steps, for example, lockdown, testing, creating good infrastructure for making people or getting best of the treatment, care of an actual COVID patient at site in a hospital, and hardcore endpoints like death in a patient of COVID. If I have to evaluate all these 6 parameters, I would put the government at 5 out of 10. Unfortunately, Sunil Bhai has given only 1 to 10 and not minus. Transparency and data sharing, Thali Bajao and Diya Jalao, and that superb app, Arogya Setu, would go into negative marking. And of course, Daman ventilators, I would not comment on Daman ventilators.
I think, Rumin,
so I think
that's okay. Rumin, I think let's be on a positive side, okay?
No, this is...
so,
in fact,
I want to add something here.
Yeah.
Samir, I want to add something here.
Please.
That you have asked a question about putting the government on a scale from 1 to 10. Why not we try to put people on the scale of 1 to 10?
Exactly.
I would put them on minus. You know, just government on its own is not going to do much. I'm not taking anybody's side, but if you are not going to wear mask, if you are going to be complacent, if you are going to not maintain the social distancing, why the lockdown was never a failure? It was a lockdown. After lockdown, the people's behavior actually let us down. It's something which is, let's not get into that, but the most important thing is our behavior is in negative. And unless we do that, like how Dharavi came up, because of the behavior or attitude changing. So I think that is something very important. That message also, as a doctor, Rumin, we should give it to the people, that you should make sure that the people you know also should behave in a way that will stop the epidemic or mitigate the transmission of virus.
So, in fact, Rumin Bhai, sorry for interruption, but since Sunil Bhai has asked me to facilitate this, I will have to play that role, because I know this is a topic very favorite to me, Rumin Bhai, Sunil Bhai, and all of us, and we keep discussing those things on many other forums. But before even we go ahead, just wanted to ask you, are your questions over? Can I move on to the questions from chat, or you still want to address some questions which you have? Rumin,
I think it's okay. Rumin,
the last question was...
Okay. Rumin.
The last question was on 1 minute, what a take away message from this epidemic for all of us.
Can I request you to hold on to that question, because that's a very powerful question. But that question will be best if it is addressed towards the end of this discussion, because that is, a parting message that both of you are giving to each one of us. Believe me, and first of all, in fact, before we go to the chat, we must thank Sunil Bhai once again for taking a brilliant initiative like Baroda Book Browser Club, that he started this Inconversation series on a very, very pertinent topic, which is of topical interest for everyone. And also to both of you panelists, Hemant Bhai and Rumin Bhai, you would have may not have a chance to look at the chat, but many people who are there right now on this, panel discussion, they are appreciating the efforts, the clarity with which you have shared, and the kind of slides that Rumin Bhai you prepared and shared, and Hemant Bhai, the way you have also shared about the entire innovation. From there we started to the way you talked, reminded all of us of our duty as citizens. So I think that's a very, very, very well designed and very well prepared questions and answers given by both of you. There are quite a few questions which have come here, and I'll take some of them, because we need to keep in mind that 12:30 is the time by which we would like to conclude. And the first one, of course, which came into very, very early stage, And therefore, although it may be the first one, or even if you have addressed, I would still like you to look at that when Amita asks, Rumin bhai, what should we do if we have mild symptoms that may or may not be due to COVID? And we won't know whether it is due to COVID or not. But if there are mild symptoms, what do we do? Probably the question is, do we immediately go for testing now that the private sector labs have also been allowed? I'm talking of city of Baroda. It changes from place to place. But what should we do?
As far as mild symptoms are concerned, I would request the person to certainly go to a clinician, one, and get basic test done, so as to be labeled as a case of COVID or not having COVID. This is basically important because, God forbid, if there is a complication which arises later on, you should be ready for that. So even if you have mild symptoms, if you have no major symptoms, you are fine. Better to get a diagnostic label so that risk stratification and line of action is ready.
I think, this question is pertinent and people have right to get scared. But having said that, this is also the season where you find a small viral infection otherwise also happening. Now, to get scared by just getting simple cough for corona is something which is out of place. So what Rumin said is there are certain few basic tests, for example, lymphocyte counts and CRP, and so simple tests. I'm not talking about the corona test. Then most important thing is if you are having fever and cough, it's better to stay indoor, number one. Take lots of liquids. Make sure that you take 1 gram of vitamin C and zinc, about 50 milligram. Make sure that your vitamin D and vitamin B12 are okay. And then whatever simple things which your physician has given, keep a watch on two things. And most important thing which I would suggest is there is a new loss of, taste sensation. Very, very important symptom. I would again tell you, if you feel that your sensation of smell and sensation of taste has gone, this is the time that you should get your corona done. If it doesn't happen, I'm telling you that if it is a simple cold, running of nose, it is very less likely that it is COVID. So this is something very, very important. Second thing is, this is for people who are not very young, those people who are, let's say, 60 plus, and they have this kind of, running, the coughing and a little bit of fever. Make sure that you give lot of importance to even small shortness of breath. So two symptoms I would definitely, and third now which is found is if you are having diarrhea for more than 2 days. Now because the ACE inhibitors, the ACE receptors through which the coronavirus enters is abundant in lungs and also abundant in intestines. So now about 20% of the people have come with diarrhea and abdominal pain. So all of a sudden, if you start having severe abdominal pain, fever and diarrhea, and if you are more than 60, I think it's time that you should be on a guard. So that's something very, very important.
Yeah. No, thanks for this clarity. In fact, very, very essential that you listed out 1, 2, 3. There is a very interesting observation by Saurabh, which is actually leading to a question. A friend, it's long one, but I'm just taking a part of it. As a friend recently remarked, it is almost better to get sick and get it over rather than living a life of self-imprisonment. What are your guidelines for living day-to-day life in the new normal with this reasonable degree of satisfaction and fulfillment? I think brilliant question, because each one of us is probably having a similar feeling, and both of you may like to address this and how you are also handling yourself, because you must be also facing similar challenge in your life.
So one thing is very clear. Most of us, knowingly or unknowingly, inadvertently, are going to get infected with this virus because of the exposure that we are going to get, because of widespread. Now, the only thing that we would wish is that we get either a very mild asymptomatic infection or an infection which is very mild and goes away. That's not in our hands. But if we take due precautions of social distancing, wearing a mask, and washing the hands very frequently, we may be able to avoid the quantum or the huge load of virus that we are going to get, and the exposure. For example, as a doctor, I would make sure that I am not exposed to a patient for a longer duration of time. I'm not very close to the patient, and wash my hands immediately. Of course, there is a due precaution of wearing a mask and face shield. So this is how But the bottom line is that I would also love to have a mild infection and get out of it rather than have something very bad later on. Hemant, your take.
Yeah, if the wishes were horses, you could go anywhere. This is a wishful thinking, but my philosophy, not for this COVID, is you can do what you can control, and you can't do what you can't control. That's a basic thing which you should understand. Now, you can do a lot of things which you can control. Like, for example, like I am a physician, Ruin is a physician, and in last, I think, 10, 15 days, I have seen about 6 COVID patients whom we detected, or Ruin has seen about 6, 7 patients who have been detected COVID. You have to make sure that you can, you use all the kinds of precautions of using those masks, and then there is a shield which is now almost like a helmet, washing the hands, keeping the distance, and there are certain norms by which you should admit or take your patients in the hospital by appointment, and then scanning them, screening them with the history of fever, not allowing, and then only the relatives would come. What we also do is that we also tell the people who are aged, and they just have to just talk about their follow-up diabetes or blood pressure medication. For their satisfaction, we say that, okay, if you want to send somebody, the youngster of the family should come. So your question was that, yeah, I think if I have the choice, I mean, I don't think that anybody would say that, oh, I don't want that. But then how would you decide that if I get COVID, I will not end up on ventilator? That's the point.
Yeah.
So, you
But
cannot guarantee.
does that mean that if you got COVID infected once, I mean, has that been conclusively established that it will not reoccur? Has that been
I think
established?
it's a very good question. In fact, this has been asked again and again. Impossible to answer, and at the moment the answer is no. You can get infected because we still don't know the antibody status. This answer will be possible only after the vaccine comes into the play, and then how many antibodies are we producing, and how long the antibody response lasts. So till that time, you have to believe that you can get reinfected.
Okay. Both of you also talked about comorbidity and certain related aspects about that, and this goes with those things. There are two aspects. One is this whole phenomenon of enzymes and blood clotting and some of those kind of things which we hear, especially about cases where people lost their lives. Are there evidences and researches proving that that is a reality, and are there any relevance or is it related to any kind of other challenges like cholesterol or diabetes or blood pressure that one might have, and therefore that is happening? These were combining two of my questions which I had written. I've just now produced. Yeah.
So the initial perception when COVID came from the huge pandemic came from China was that this was pure lung injury, something known as acute lung injury, causing massive pneumonia, fibrosis, respiratory failure, and then death. Thereafter, especially in places in Europe, Italy and Spain, it was found out that that was not the only concern. A lot of patients had clotting abnormality and secondary to that bleeding. So this is known as DIC, disseminated intravascular coagulation, clotting inside and then bleeding outside. And this was a major reason for death in such patients, causing a high amount of mortality and morbidity and mortality. And therefore, there have been consensus statements about how to detect such patients having a predominant blood clotting as a cause of death or as a cause of morbidity or as a cause of worsening, and then treat them aggressively with some newer drugs.
Hemant, you want to add anything here?
That is right. You know what happened was some of my very close friends who are very senior now in ICU in New York and New Jersey. So I was in touch with them when the New York was at the very bad phase, and he says that Hemant, it's almost a rule of thumb that when the patient is to be put on ventilator, hardly anybody survives. Oh. And that actually started the thought process that, we have been handling so many lung injuries with ventilators, and USA has best of the best facilities. Why the patients are not surviving? And that is where this thought process started. And then there were certain autopsy done on some of the patients who died. And they found that in pulmonary artery, there were lots of clots, the blood clots. And that's that. Then they came up. I'm not going into the technical side about cytokines and all those things, but then there are ways by which this coronavirus can cause the clotting of the body all the blood vessels. That is where the value of a test called D-dimer came into the picture. So now what happens is that China has already developed an algorithm. I don't think it's very difficult. We can also do. But if the person who is admitted, and if his D-dimer is very high, his ferritin is very high, his prothrombin time is very high, then this is the patient who is going to be in trouble. So now that much data actually they could give us, and that's why now the person who comes in a serious state, it is a very routine thing to give drugs which will dissolve the that's called as anticoagulants. So that is another very important finding that we have, and I think many patients have survived. If I am allowed to tell you one more development which happened, how the medical fraternity is also learning. We knew about what we call as a prone ventilation. What happens is that most of the times you are supine. But in some patients, we used to do prone ventilation. But then it is found that, in one study, and now it has become a norm, that patients who are very bad, they are actually given a prone position and ventilated, and people have survived. So, I still know one VVIP who actually is almost surviving because of this prone ventilatory support.
Okay.
So we are learning a lot, and I think it will still continue. We'll continue to learn because it's a new virus.
I think, as both of you said, that things are evolving. So I think there is a learning every day. There is a very interesting and pragmatic question by Mr. Sasisekhar. He said, since future consultations would be mostly video linked, what are the diagnostic instruments we should keep at home?
So besides the regular thermometer, which every house has, a blood pressure machine, which is now actually a norm of blood pressure treatment everywhere in the world, which is known as home blood pressure measurement, a good electronic blood pressure machine, which should be calibrated with a mercury machine with your doctor. So that is one thing that I would keep at my house. Second thing that I would keep is a pulse oximeter to find out a drop in oxygen either at rest or on exercise or after being symptomatic. And third, and very important thing, if possible, have a glucometer for a blood sugar estimate. So these are the three things I would keep as a diagnostic tool at my residence.
Agreed. Yeah.
Anything else?
That's fine.
Great. Another important question is, sir, how Fabiflu tablet is useful for COVID-19? This is from Hemang Kumar.
Honestly speaking, lots of medicines have been tried, and there was something called as a solidarity trial, which is already on by World Health Organization, where they came up with 5 drugs. So what is happening is, people are trying one drug or the other. If you actually go into our technical data from one of the Lancet article, you'll be surprised to know that there are 52 drugs which are being tried. We just, you hear whatever comes in your Times of India or Gujarat Samachar, right? But in fact, there are 52 drugs which are being tried, and many of them are antiviral. Now, for example, tocilizumab is considered to be anti-inflammatory, which is saving people. Now, there is another molecule which has come just today as a guideline that some people tried the other group of tocilizumab, and it was effective. So tomorrow you'll find a newspaper that is working. In between, you found that we have found the drug called Dexona. Now, friend, Dexona is a steroid, which we have been using for, I think, more than 300 years or 200 years. But the point was that it was used only for inflammation. It was not for corona. So what I'm saying is that, in some data, there are some data, I'm thinking Rumin might be knowing that there were some papers or some patients were given this molecule and they showed some response. And so that's still an anecdotal. This is still not something which has really been passed on as a, guideline to treat corona.
Mm-hmm.
Shall I just add one thing? Now, there are lots of questions and there is a lot of confusion about chloroquine and hydroxychloroquine as a prophylactic, whether you should be taking that drug on a regular basis to prevent COVID. Now, not a single international organization or body has recommended use of chloroquine as a prophylactic. It is not effective in patients, number one. Number two, in a patient having comorbidity like blood pressure or a heart problem, if there is a baseline ECG abnormality, taking hydroxychloroquine or chloroquine can lead to some complications and irregular heart rate and so on. Again, there there have been very harsh editorials in some of the best peer-reviewed journals, clearly telling that chloroquine has no use in prevention of COVID. But there are patients who say, fine, you go on taking it. But by and large, I would not recommend it as a scientific preventive treatment.
Rumin, can I add? Because this is an interesting point Rumin has come up with from here. This is a Pandora's box that he has opened up, Rumin. I and Rumin have been always of this opinion, and we still stick to this opinion. In fact, I go one step ahead, and you tell me how much is malaria prevented by chloroquine? A definitive medicine for malaria is chloroquine. Correct. And how much is malaria even prevented by chloroquine? So when you know the drug which is definitively curative is also not giving you protection, a drug you are using for something which you do not know the effect, but you definitely know the side effect. Why should you do that? And having said that, many doctors, I am telling you, they're still taking, no, we want to take it. So that's your choice. Ultimately at the end of the day, what you do in your home is your prerogative. It's our duty to tell you that what is scientific and what is not scientific. So I and Rumin are on the same page as far as the prophylaxis with hydroxychloroquine is concerned.
Right. No, good that both of you clarified. In fact, I always wonder as to how doctors must be keeping in tune with the latest development on daily basis, because there are conflicting opinions that you read in media and other places. And I'm happy that both of you are on same page. So at least that gives us a confidence that yes, what you are saying. but on this, yes. There is a relevant question about vaccines which are being developed in India. And I would not allow this to be discussed about 15th August launch, because that may be favorite topic of few others. But purely on the scientific and technical perspective, the question is from Harit Kumar. Will vaccines developed in India and the usefulness about those things? If you have some data and if you want to throw some perspective, I know everything may not be there available in black and white, but if at all you want to throw some light on that.
There are almost between 15 to 22 vaccine trials all over the world for COVID infection. At least 3 pharmaceutical companies in India, Zydus, I think, Poonawalla from the Serum Institute, and I think DRL, they are working on this. Now, any vaccine takes a long time to evolve because of various procedural, and as I told you, do no harm. But in this, the platform that is being used is little different. They are not using the standard platform of the antigen, and they are using some microRNA and RNA platform, and that's why the vaccine development is going to be expedited. But I would be actually surprised if there is a vaccine before 2021, an effective vaccine. As also because the virus is going a lot of mutations, number one, and number two, there is a small possibility of a patient having some other problem because of vaccine. For example, there have been cases of Parkinsonism which have been precipitated by influenza vaccine in some patients. So I wouldn't like to take a vaccine which, number one, is not 100% effective, and number two, if it is effective, it causes some complication in me. Hemant, your take?
I think this is a good question, and I think I can take a couple of things with this if Samir allows me.
Please.
So, if you go on a World Health Organization site, in fact, there were 62 vaccines which have been, registered. And out of which, as Rumin said, there are 4 or 5 vaccines which have gone into what we call as a human phase trial. Now, for those people who are non-medical, let me explain you how the entire vaccine is produced. Vaccine is basically either the virus which is killed, the whole virus which is killed, attenuated, and it is given. Or now the new vaccines, what they do is they pick up a part of the vaccine. For example, in Corona, all of you must have seen the picture by now that there's those spikes which are seen on Corona. They are called a spike protein. So the vaccine would be created against spike protein so that the proteins cannot go into your cells and will not damage you. So this is a different type of technology, the RNA virus technology that is being developed. So once it has to be given to the animals, and once the animals, you find that they're, because Rumin rightly said that it is not just the efficacy, but you have to make sure that it is safe, because it is even more important than, being efficacious. So that's something very important. So once those vaccines clear that hurdle, then there is something called as a small trial on humans, which is called the phase 1. So what happens here, phase 2, is a very small number of volunteers are selected, and the vaccines are given to them. And then if there is nothing happen, then it has to go to the last phase, where good number of people are given. And if they are satisfied about the antibody response, if they are satisfied about the safety, then only the vaccine is available and cleared by FDA or whatever the drug authorization is. So this is something which you have to understand. And as I said that, two interesting things, Samir, for those who are, history buffs. It's very interesting. Spanish flu happened during First World War. It was
Correct.
1918.
Correct.
And you know that the Spanish flu, that influenza vaccine, how much time did it take? Very, very interesting. The vaccine against influenza came at the time of Second World War.
Oh.
So imagine the time taken between First World War and Second World War. These many years were taken by the influenza vaccine to develop, because at that time the technology was not as robust as what we have today. Then came Ebola, which actually took only 5 years to develop vaccine, and the entire medical fraternity was excited that, wow, just 5 years and you have the vaccine. And now we are going for even more wow, because I think it's 1.5 years and perhaps we will have vaccine. And it will be the golden day. But at the same time, Rumin rightly said that it has to be efficacious and unsafe. It should be safe. And then most important thing, Samir, is your people like you, not medical people, but the management people like you. Is most important thing is how costly it would be, how many people will be given, who will be given the priority, and how it will be given. Right?
Yeah,
So
I think there are lots of questions, and therefore what Radhika and Chirag have written here makes a lot of sense. When Radhika says, what percentage death rate, this is straight, but what percentage death rate can we relax and consider COVID-19 in league with other disease? Why does the death rate go down after some time? And Chirag said, is it true that the fatality is 0.5% only, therefore we can reverse calculate infection rate? So maybe the whole aspect of fatality. Yeah, Rumin bhai, you can first start.
I'll show you. Just give me another minute. I'll show you.
Please.
Just one last.
You can share the screen, yes.
This is So I'm sorry for that.
Yeah, no issues.
That's just one last. I have shown this fatality rate. I have a slide about the fatality rate.
Yes.
And that clearly shows that this is going to be extremely high. I know, not this. This is not the slide. Oh, I have this. Anyway,
you can just say extempore, no problem. Okay,
the mortality. The we call it IFR, or infection mortality, infection fatality rate, IFR.
Exactly.
And that is going to be extremely high if a vaccine does not come. And the mortality rate, which is now roughly 2.5%, roughly all over world. But that figure varies in elderly population, varies in patients with comorbidity, and varies when there is a sudden cytokine storm. But we can roughly expect the case in fatality rate to be around 2.5 to 3%, and maybe higher in when vaccine is not likely to be available and with the conventional treatment that we have. Anything else?
I think she asked the question that what death rate we should relax. 0%. You just can't relax. Even if there is, I'm telling you, this is Samir. This is something. Somebody says that when many people die, it's a statistics, and very few people from your family die. It's a disaster.
Correct.
So it's from some perspective you can say, well, it is just 2%. To me, it's a 2%. You just can't take that way. So I would not relax anyhow, even if, it's just a 0.1% death rate. I don't think that you should relax, because you could be one of those 0.1%. Nobody has defined that you will be there. So it's a lot of things are happening, virus load and your own immunity, your own genetic structure, so on and so forth. Many young doctors are dying, and without any, they were healthy and hearty without any comorbidities. So we still have to learn why did they die? So that's the point I'm telling you that, friends, this is a real uncertain virus, and we are also still learning. So please do not relax at all.
Correct. I think that's a good insight and good caution that both of you gave. Before you go on to the last parting advice or the question which you had, the last question, and I stopped you. I think it would be a good idea to throw some light on these shortages of remdesivir and the drugs, and also plasma therapy. I mean, some of these things which we keep hearing, and especially Delhi CM talks about it and all those things. So maybe a quick thought on that. And I also want to take this chance to share with all our viewers here. There are several views, observations, questions, including for 2 years old to Arogya Setu app, everything. And for the positive, because if we read and discuss everything, I think we need time up to 3 o'clock. But that shows of the curiosity and interest that both of you generated because of very, very fantastic and very intriguing discussion that you both did. So covering those aspects of shortages of drugs, plasma and other aspects, and your parting thoughts, both of you. And then I will read what Sunil Bhai has written as his parting philosophy. And then we will conclude. Yeah.
So before coming to shortage of drug, let me tell you a very small incident. A cousin of mine is admitted in a hospital with COVID infection.
Okay.
He was admitted Friday morning. His son also turned out to be positive, has fever, needs an admission in the same hospital. It is 36 hours, the hospital doesn't have vacancy. So there is, in short, every hospital worth a name in Baroda having COVID facility has a huge waiting list of patients to be admitted. So if you don't get a bed, there is a question of getting a good drug. So agreed, remdesivir and tocilizumab are not easily available, and that is purely because the demand is far more than the supply. But with proper connection, at proper setup, with proper pricing, maybe little more, you should be able to get it. Hemant, your take.
I think he's right, and actually this scenario of overcrowded or no beds at all, the same thing is happening in our town. The Karamsad hospital has got 150 ultra modern ICU, which is for COVID, which is totally full. The Anand Municipal Hospital, which has got about 50 bed, is totally full, and the surrounding some civil hospitals are also full. So the government is now forcing us, the private doctors, that make your hospital available. Anyway, that's another story. Now about remdesivir and tocilizumab, they are definitely good drugs. But Samir, I tell you that we are all in this platform, and God has been kind to us that we can afford this. I'm telling you a very simple thing. Remdesivir and tocilizumab, if at all you want to, utilize, you have to shell out lakhs of rupees. So it's not that. It's not at all. It's just a 50 rupees or 100 rupees medicine. Remember that. One tocilizumab will cost you 40,000 rupees. Right, and remdesivir you have to give for 5 days at least, if in a simple case, and 10 days in a patient who has got a complicated thing. So those drugs, so I think this is where the government has come into picture. This is where your PM Care Fund has to come into the picture, because this is where you can help people to make these things available, and so that you can save many patients. So I think, and about your antibody, there's still data which are still coming in. For example, Mount Sinai Hospital, New York, came up with the first data because they were the people who tried this first. As you said that, the antibody transfusion from the person who has already recovered from COVID. But I think it's a good idea if, as a NGO also, if you can just start this drive and motivate people, those who have come out of Corona, you can create that bank, and maybe it can help some people. So I think my parting thought would be that, friends, you should not panic, but at the same time, you cannot neglect. So Corona is contagious. Corona is uncertain. We are still into uncharting waters. But having said that, we have also found out many things which will make us win over Corona. Everything is here to go. Tomorrow, Corona will definitely go, but our behavior, our attitude towards our hygiene, ourselves, our health should definitely change for better. And rather than a new normal, I would say it should be a new, better normal.
Absolutely. Yeah, Ravin bhai, please.
My parting message: one, Corona is going to stay. Corona is going to stay here. It's like influenza, like malaria, like jaundice, like typhoid. It's going to stay. Number one. Hopefully, the virulence and hopefully the morbidity and mortality will go down.
Definitely.
Maybe because of vaccine, because of immunity. Number one. Number two, so there is no time lag that March, January, America. No, that is out. One, two, the facilities are going to improve and we are going to have better infrastructure. Possibly antibody testing will help us in early diagnosis and early picking up the cases and management. But hopefully, when all of us would get a part of it or so, we'll have some minor infection if we take proper care. So, standard basic norms would be now hand washing, social distancing, and mask. That's it.
The last thing
Thank
which
you so much.
Rumin we could have covered. I'm sorry because it's something
Please,
which I think people should know this. The COVID testing. Everybody knows about that PCR test where the swabs are taken and the PCR test is done at some of the laboratories and you get the report in, let's say, 24 hours. And then there was another test by which the blood is taken where the antibodies were detected, which actually had problem. But there is another test which is now cleared by ICMR, which is cleared by United States, which is called as a point of care. What it does is that, there also you can take a swab. But the test is developed in such a way that that also will detect virus at antigen. So difference between antibody and antigen is the antigen itself is a virus. So just like in PCR you find the virus, this is called as a PCR antigen test. So this will give you result in only 2 hours time. That's why it is called as a point of care test. So it is possible that you can come up with lots of kiosks. Well, some NGOs can help. You can just do the test of in a mass and on the spot you get the result. So that is now cleared by, and that is even cheaper than the conventional, 4,000 rupees test. So this is very important. And last thing, what Rumin rightly said, that we have to live with this. After GB influenza, we are still with it. So we will still be with Corona, but it will go giving you some cough and cold, and you will not even remember that. Okay, so that's the wishful and hopeful thinking. Thank you very much, Sunil and Samir, at this time, and thank you all the viewers who have really bared us. You have been with us for such a long time, and I hope that at least we could be of help, because experts are the one who are defined as something. They make the simple thing confusing. And I hope that we have not done that.
No, in fact, I would say that you brought a lot of simplicity and you made complex things simpler for all of us to understand and make it very, very easy for us to understand. While the take is very simple, we need to be cautious. But at the same time, I think both of you created that cautious optimism, or what I would say realism. And I think that way it generated a lot of clarity for all of us. And your last sentence that, death rate will go down is bringing renewed confidence and faith in all of us that yes. And in fact, quite a few of them have written, and I'm conveying on their behalf to both of you that you take care. Your families must be really worried. That's what someone has written. But all the doctors and healthcare warriors, I think we really, really salute them. And yesterday, we did not discuss that part of Mr. Amitabh Bachchan getting COVID. But I think one of his old videos about Nanavati Hospital, and that's where he is also talking about the same thing. But the architect of this entire thing is Sunil Bhai, and we must, say what he wrote. He wrote two things, and we might have written other things also. But by the time I read one, there are at least 10 more messages getting added. So Sunil Bhai wrote, my parting philosophical lines, and this is I quote, to describe this pandemic caused situation is this seemingly black swan event is in fact an omnipresent reality we all will have to live with, given the degradation of environment and degradation of environment we have caused because of abuse of resources and excessive consumerism. In fact, phenomenon of zoonotic disease is already upon humanity, where an infection is transmitted from animals to human bodies. There are some observations some time back about it. Final takeaway, we are not now in a situation wherein we can set the sail of a voyage. In fact, we are required to adjust the cell while our voyage is already on its cell. And in mid-sea, we all need to rejig our lifestyle, work style, and social connect style. So there are still many observations. I will, of course, I would like to thank Shambhavi, a young girl who has been helping Baroda Book Browser Club and all of us for all those dry runs and handholding all the panelists and all of us time and again every Sunday, or I mean, every once in 3 weeks, 4 weeks, whenever we request for her help. So thanks, a huge thanks and shout out for you, Shambhavi. And thank you very much once again, Dr. Rumin, Dr. Hemant, and also Sunil Vakil for setting a very nice platform. I'm sure when we will upload these on YouTube, there will be several views of this particular discussion. So, and I convey best wishes, stay healthy, stay safe, stay immune, and follow what advices Dr. Rumin and Dr. Hemant gave to all of us, and be confident about our survival and happy life. Okay.
Thank you. Thank you very much.